So today was a big one for our freedom to breathe and smile without a mask indoors. While it's no longer mandatory to wear face masks indoors, Health Minister Joe Phaahla is advising people with chronic health conditions just to be safe and continue using them. He says the decision to cancel most of the regulations motivated by a really significant drop in COVID-19 cases. Our reporter Heidi Giokos attended the minister's briefing. She joins us now. So Heidi, I mean, we were hoping yesterday, weren't we, just saying, oh, won't it be today? Let's hope it is. We can enjoy this moment. There's a great deal of celebration. Already the memes are coming out, which are just hilarious. But the health minister, of course, we got the news last night, that late night announcement and government gazette notice, but the health minister really making it official, really.
Yes, certainly. I must say I'm very happy I can show off my teeth. I paid a lot of money for these teeth. So I'm joining in on all these memes where people are just like, I do not need to have a mask when I get into any indoor environments. But we do understand that the health minister indicating today that officially government has taken the decision to do away with the 3 remaining COVID-19 regulations. The big one, of course, being the fact that it's not compulsory to wear a mask, be it indoors or at any facility indoors. We do know that outdoor mask wearing was scrapped and done away with a while ago. The second COVID-19 regulation includes the limitation of public events and gatherings. That is also done away with. And another big one, Sally, is when you are entering the country, you do not need to provide a negative PCR test or proof of vaccination. Which is also very big. We do know that government was in talks with this, but that is no longer needed.
That's huge. So you don't need, not only do you not need to wear a mask on the plane,
yes,
when you enter South Africa, you don't need a PCR test.
A negative PCR.
You don't even need a vaccination.
Proof of vaccination, yes.
That's massive.
So what we do know is that the health minister is saying because the data's proving otherwise and saying that your numbers are very low, hospitalization is very low, and deaths are also very low, and you have an opportunity to be vaccinated, government has taken the decision to do away with these 3 regulations. They just feel as though, for example, the 5th wave wasn't as severe as predicted, and they believe that the data points to the fact that you don't have to wear a mask or the other 2 regulations. I think it's important to highlight the fact, though, that the health minister is saying those who feel vulnerable, those who have comorbidities, or those who are around high-risk individuals, for example, the elderly, grandparents, parents who might be a little bit more vulnerable or at risk, they can still wear their masks. Another important issue is the fact that the health minister is saying should a public facility, be it a restaurant, an old age home, even a school, decide that they feel as though masks should be worn indoors, they can still do so. But in terms of government's regulations and mandates, it is not necessary to wear a mask indoors. Let's listen to Health Minister Dr. Joe Phaahla.
What is off the table? It's a compulsory wearing of mask in certain settings, which over the last 3 months or so was only in indoor meetings and indoor settings. So that the compulsory nature. But we emphasize the fact that masks have proven to be very good in preventing, especially respiratory transmission of respiratory diseases. And we also need to maybe just add to say we would still encourage citizens, especially in indoor settings, especially where they are gathered with other people, feel free to wear a mask because the mask has shown to be helpful in terms of preventing especially respiratory transmission of respiratory diseases, especially if you consider yourself and your medical advisor as at risk in terms of age, in terms of comorbidities like diabetes, heart disease, and respiratory diseases, chronic lung disease, having had TB, for instance, before, and all those kind of ailments. So I would want to urge all South Africans that don't feel embarrassed simply because government has said it's no more compulsory. All that you are saying is it is in our hands now to make those decisions, as also advised by our health advisors.
Okay, well, that's pretty clear. I think it's important as well. I think mask wearing has become part of who we are in a sense. Certainly for me, if I'm not feeling particularly well, I think I'll wear a mask to protect those around me. Similarly, if I'm going to be with elderly people who I know are frail, it might be a good idea to wear the mask. And it's not such a big deal anymore for those particular incidents. But I suppose apart from our sense of freedom and just delight at feeling that life is getting back to normal, it's a huge boost for the eventing business, for tourism, etc. I want to speak to you about vaccinations, though. He did go through the latest vaccination levels, and we sort of roughly, give or take, depending on the province, at around 50% of adults vaccinated. But we should still be getting our boosters because they have quite a lot of stock that needs to be used, and those boosters are needed to keep us up to speed, especially if we want to travel internationally, where those jab certificates are going to be required.
Yes, Sally, but that's an interesting point, because some countries nowadays don't require you to have proof of vaccination. For example, if you're traveling to some parts of Europe, Greece, for example, does not require you to have a proof of vaccination or a negative PCR test. So it seems as though countries are adopting a new way of entering countries, which previously we saw you had to have a negative PCR test or you had to have proof of vaccination. What we do know is that by November, there could possibly be 8 million Pfizer vaccines being discarded because the uptake is so low in terms of vaccinations. That means people are just not either getting their first or second Pfizer dosage or their boosters. The health minister, of course, calling on anybody who has not been vaccinated, either with the first or second dose or even boosted, should go out and get vaccinated. There is no way that government can try and do away with those 8 million, perhaps selling it to other countries, because we've already purchased that. It seems as though vaccine uptake across the African continent and across the country at the moment is not where many would thought it would be at this stage. What we do know is that government was in a position to waiver an order from Pfizer, and it's rather saved the country 1.4 billion rand. So government's done good with regards to trying to stop certain orders from arriving, because they've just seen how they're just not using the vaccines as they thought they would. But the fact that 8 million vaccines could possibly be destroyed in November is very worrying for government. But the health minister is saying there's very little that they can do. They have programs, they are encouraging people to get vaccinated, and they have not met that goal, Sally, of 70% vaccinated by December last year. We are at about 50% now, but still government is not entirely happy. But they're saying they're satisfied with the fact that the adult population, the most vulnerable age group, which is 50 and above, are mostly vaccinated. That is sitting at about 60%.
Yeah, and that is good news, certainly. So essentially we're at the endemic stage, where it's in our society pretty much like influenza, and you can get a jab, you should get a jab, because these viruses can be pretty awful. But it's endemic. We're managing it as a society in terms of our hospitalizations. We're not getting overcrowded anymore, which is fantastic news. So almost bye-bye, COVID. But hello, monkeypox. I mean, he just dropped it into the press conference. And we've got our first case of monkeypox. Now, here's the question, Heidi. I know you've got a bite from the minister, but how worried should we really be about monkeypox?
Well, Sally, that was my first question to the minister, because we were told in 2020 that we have our first case of COVID-19 and nobody should panic. Everybody should calm down. There's nothing to be alarmed about. And look where we are 2.5 years later. Yes, the health minister did answer and say it's two very different viruses that we are looking at here. COVID-19 was constantly changing. There were variants that were constantly emerging. It was a lot more transmissible, highly transmissible. Whereas with monkeypox, that's not necessarily the case.
And they've known about it for years, haven't they?
Yes.
And they've got treatments.
Yes. And also, from my understanding, if you've been vaccinated for smallpox, you actually have some kind of coverage, because it is a form of smallpox.
Okay.
So we do know that the health minister is saying, do not worry, it's only 1% fatality rate. And we also know that the other big issue is the fact that the individual that's tested for monkeypox was not traveling. So the health minister and laboratories are trying to find a way to figure out where this came from and how far it's actually spread. Let's listen to the health minister.
Late yesterday, I received a report from the National Health Laboratory Service indicating that they have confirmed through a laboratory test the first case of monkeypox in South Africa. The patient is a 30-year-old male from Johannesburg who has no travel history, meaning that it cannot be attributed to the disease having been acquired elsewhere. So it means that it is with us. So working with the relevant health authorities, a process of contact tracing started to trace the close contacts of this gentleman. Monkeypox is usually a very mild disease, manifesting as blisters on the skin. It is usually mild and self-limiting, with a very limited fatality rate of about 1%. The disease has previously been reported in African countries such as Nigeria, DRC, Central African Republic, and Ghana in the early 2000s.
So we should not freak out about monkeypox. Good. I will not freak out about monkeypox. Thank you very much for that comprehensive breakdown and the good news that we don't have to wear masks anymore, Heidi Giokos. All right, but let's